Bobby Elliott, Phil Slonkosky, and I'm Gerry Samson. I would like to mention again, as I mentioned previously, that if you are having any problems with the presentation, please be aware that the further you are from your router, if you're on Wi-Fi, the more the quality of the presentation will stumble, you'll get pixelated, and our voices will fade in and out. We've done everything we can on our side to make certain that you're receiving a high quality presentation. If you'd like to take a screenshot of this for any questions, comments, or in some cases, smart remarks, you can see Martha Ann Keels, Bobby Elliott, Pediatric Dental Directions, Phil Slonkosky, also Pediatric Dental Directions, and there is my email. My education company is Nathos Incorporated. Some of you have asked about forms that I've been sending out. Many of those forms are courtesy of Larry Gerald, who's an attorney, dentist, orthodontist. George Gutierrez also forwarded some very, very good material. And I'm happy and have permission to send that to everyone, but you do need to contact me at my email address for me to send that to you. Our next presentation is a week from today. Of course, these things are all being recorded for your viewing pleasure on YouTube, and those will be on YouTube at your disposal. Our next presentation is Tuesday, April 28th, a week from today, at noon Eastern time, and we're going to focus on business decisions in a bit of a town hall format. Those business decision experts that have been invited are Michael Schwartz, Chief Executive Officer of Specialty Dental Brands, a substantial organization focusing on pediatric dentistry. Orthodontics, there is a small endo component as well as a small surgery, oral surgery component. And Michael will focus on things from the dental service organization corporate dentistry standpoint. Most everyone who's a pediatric dentist will recognize former president of the American Academy of Pediatric Dentistry, Rob Della Rosa. Rob is in Baton Rouge, Louisiana, and has consented to be on the program a week from today. Rob has always impressed all of us who know him with his remarkable business ability, his ethics, as well as his willingness to explain exactly why he has done what he has done, and he's very, very transparent about mistakes that he's made. You may hear him say, oh, I've done that, I'll never do that again. Also consenting to be on the program is one of the leading people in the United States in risk management and informed consent. Larry Gerald is dual trained as an orthodontist. He's also a lawyer, and I believe Larry has a degree in ethics in the humanities as well. He writes the litigation column every month in the American Journal of Orthodontics. A highly unique individual, a close personal friend, and he'll be joining the panel of the usual suspects. Today's presentation, as you know, will focus and center around what Martha Ann Keels has to say. That's it, baby. High school.
Hey, baby, won't you take a chance? Say that you'll let me have this dance. Listen.
That's enough. Now, I'm going to stop my screen sharing, and we're going to switch to Martha Ann's presentation. Martha Ann?
All right, you have it?
Looks like you're up.
So I'm going to jump in real fast before Martha Ann takes off. We had some audio difficulties when we were on last time on this portion about what not to say to the team. So we wanted to just quickly review that so that you had that audio piece. As important of the things to say to the team, it's as important to consider what not to say. The first one is you never want to tell anybody to calm down, and we certainly don't want to minimize the situation by saying that there's nothing to worry about. It's also important to not discuss death rates or other negative figures. We did talk about why it's important to acknowledge their fear, but at the same time, we want to try to keep everything as positive as possible. It's super important to stay humble through this process as well. You don't want to discuss how this has negatively affected either your personal finances, your vacations, or any missed trips that you may have. This is not the time to share that with your team. They're going through their own struggles. It's also important not to discuss any behind the scenes business discussions, however much we're paying on our rent. And even though we've got no cash flow coming in, that is not their issue to worry about. Try to keep everything as positive as you can. And finally, we just don't know when we're going back. This is going to be individual for each state based on each governor's decision. But at this point, we just don't have a date. So we are not giving them any type of false hope or date until we have more information.
I think what I'd like to jump in on that one is you have to give people some idea about this and saying, we don't know, that leaves us as frustrated as everybody. So I think that the underscoring that you would want to hear if you were the parent or you were an adult patient, because we have general dental specialists online as well, is safety first, safety always. Once we are confident that we know exactly what the safest thing to do is from the Centers for Disease Control, from the government, we will move forward, but not until we're certain that everyone will be safe. And I think that does give them an answer, even though it's not a start date. And with that, Martha Ann.
All righty. So this time, this part 3, we wanted to focus on our patients, but I first wanted to kind of revert back to our recommendation if you do get a chance to do the happiness course with the professor at Yale, Laura Santos. But one of the things that gives you happiness for a longer time, like over 60 days, is doing something grateful for someone else. And I'd highly recommend, even if you were fortunate to get your PPP funded or your EIDL funded, for those who didn't, this is the day to call, email your senators or representatives, and you can email Speaker of the House. If you're not from California, just Google Speaker of the House and you can email her directly, because they're coming back to DC on Wednesday now to vote on this. They've hit a stumbling block. So we need to be blowing up their phones saying to provide critical care. That what we do is provide critical care for children in the United States. So everyone jump on that today. So I broke it down into kind of 6 steps of how I kind of organized the strategy of dealing with COVID-19. And then a few people have asked if I would just give my SOP, my standard operating procedure for right at this moment for how we're dealing with emergency care. So the first one was just the close down communication process. So hopefully we've all done this, but I'm just putting it up there because if we have a resurgence, then we're going to be going back to step 1 again. So, and then you'll be getting the slide deck, so you don't have to like write anything down. It's one, just immediately, if we've got to shut down again, stop your appointment reminders, whether that's Lighthouse, whatever system you use, and then start an electronic communication to all your patients. So we let our patients know that we will be communicating with them every Monday for the first 4 weeks, and then on an as-needed basis. So the first letter went out was just how we're going to screen you for COVID-19. That's your travel, your fever, any close contacts, and then the hygiene protocol for the practice, which at that point, this was before we got the shutdown, was washing your hands with the hand sanitizer before and leaving the practice. The second letter that went out on the second Monday was telling our practice that we were in compliance on March 16th with our governor's orders in the ADA that we needed to close down except for emergency and urgent care. The third reminder was telling them that we were open for teledentistry and that we were open for emergencies and trauma, and that we would be screening them and getting up with them, and then also constantly reminding them that we would be calling them to reschedule their appointment, that they didn't need to worry about that. The fourth one was because we do some orthodontic care. There's quad helixes, phase 1, some phase 2. We needed to get the reminders out to our orthodontic patients about keeping their teeth clean, about how to wear their rubber bands, how to wear their headgear, And then we would be calling them individually to follow up on questions and the Invisalign cases, what we were doing. Letter 5 is currently on hold, and that's being built at the moment, is to finalize our office standard operating procedure for how we're going to handle when you come in for elective care. And we're still waiting sort of to hear what our rule makers are going to tell us we have to do. And then we are continuing to send statements, and it's also giving the opportunity for the families to contact back to us to ask for the pause. No different than many of us have asked for pause on rent or pause on paying your dental suppliers. So far, we've only out of close to 10,000 patients, only had a handful ask for pause in payment. And certainly we are pausing for payment. And on all of those letters, just an FYI, we say, you know, if you don't want to see these letters, please let us know and we'll take you off the letter receiving list, which is a letter going electronically, not snail mail. No one has asked us to stop sending them a letter.
Let me ask a question about that. If on step 1, closing down communications, could you give me a little bit of repeat or clarification on that, and maybe some any questions or comments from Bobby or Phil? When you say close down communications,
Well, that was just meaning that the communications that needed to happen when I knew we were headed into a close down, as well as what happened the minute we got closed down. So that letter 1 was, you know, based on what was happening in the Durham and Duke University community, that people were being communicated to. This was before we got shut down, of saying, you know, we're going to be screening you if you've had any COVID exposure, and we're going to institute some hand hygiene protocol. And then we propped open all the doors coming into the practice, so no one was touching any door handles. So you would come in and hand sanitize. And this was before, I mean, this is when we could use our waiting room. And then, you know, letter 2 is going out as when we got the mandate that we had to close our doors except for emergency care.
and you say these are all being sent out electronically, is that right?
I use Lighthouse, but whatever system you have that you're able to upload a letter and boom, on your letterhead, it goes out to your entire patient population.
And Gerry, to reference what your question was also, you want to make sure that you shut down communication, meaning appointment reminders. You don't want the letter to go out that says we're closed, and then they get an appointment reminder that says, by the way, you have an appointment on April 13th.
Correct.
Yeah, not cool. Phil, do you have anything on that step 1 point?
No, that's, I think all of us have pretty much had to address that one way or another.
When Martha Ann mentioned you'll be receiving a slide deck, I've sent out, Bobby and Phil did a absolutely first-class job of a synopsis of their presentation, bullet points, and even a few comments. And I've sent that to all the people whose emails that I have. You can contact me directly. You can contact any of us to get those notes because they're quite useful. One of the other things I'll underscore about this is that you need to bear in mind that when your patients and the families are getting this information, that once probably isn't enough. You know yourself that you've got all kinds of things swirling around in your mind, and a bit of repetition is really a good thing. It shows that you're actually concerned enough that they understand. And I think Martha Ann mentioned this, but I'll underscore the idea that these people need really to understand they can contact you as necessary with some mobile phone numbers. And I think the new mode of customer service is going to be an amplification of things that you may have heard before. For example, are you willing to give people your mobile number? Are you willing to actually give that out? Or an associate's mobile number? Who's on call? Are you willing to do that? Because those people that are not willing to do it really are not going to prevail. This is a whole amplified level of customer service. And making sure that these people understand that in anything that they receive by email, which I think is fine, I think that there should be a number for them to call with any questions or concerns. Any comment from the other three people?
But we've done that. They know how to reach us, and probably to amplify letter number 3 was, I didn't type it there, but we also included that you can call and schedule a teledentistry appointment, and probably there will be another letter, probably a letter 6, where I refine that of what that's going to be. You know, because I think teledentistry will be part of our culture going forward, and I'm constantly fine tuning that process of, you know, how you write.
I'll be able to put those up on IPDO. I'll post all 3 of our post synopsis notes when I post this video along with the other 2.
There have been some wild things that have happened in the orthodontic community from the American Association of Orthodontists Insurance Company, AAOIC, came out with a consent letter for visiting the office, not a virtual visit, an actual orthodontic visit, that the membership by and large, I'm staying neutral on this, so let's not make the mistake of thinking that you know what I think, because I'm not going to burden you with that. But the majority of people that were vocal about this on the social media were really offended by how aggressive this first letter was. Now they've modified it. They've softened it up a great deal. This is for an orthodontic patient coming to the office. The first letter sounded like, well, you are taking responsibility, and you know full well that if you walk into this office, you could die from any disease known to humankind, and even those that haven't been found out yet. Yeah, you can all like be. So now they've softened that up a great deal. But I don't know, and I'm pleading ignorance on this, if the Academy or the ADA has come out with anything like that. Martha Ann, do you have a comment about that?
Well, I think that, I'm keeping my eye on the American Academy of Pediatrics, and our local state pediatric society has sort of instituted a plan of telehealth A and a telehealth B. And a telehealth A is kind of a lot what we're doing right now, is giving critical advice, but at the end of it saying, you know, I feel like I don't need to see you. I don't need to physically see you to solve this problem. And then part B, so there's 2 different billings for part A and a billing for part B. And part B is at the end of A, you say, given all the information that I've gleaned from you, I really need to see your child to sort this out. So I think it's morphing, it's evolving as now so many people are doing telehealth. So I think it's totally evolving, and I think I would recommend starting to do it, and just, and I certainly can share, I listened to all the different teledentistry, the ADA one, and a couple others, and we formatted our chart note so that it's got all the legal part, and then I'll listen to Dr. Gerald and see what else I've probably forgotten. And I think this is a work in progress, like so many of the other things we're doing right now, is it's morphing as we speak.
There's a question that I see that's quite interesting. What do you do when a parent has a dental concern for their child but says they are going to refuse to pay for an exam via teledentistry? Now, you know, I don't really want to put that off until next Tuesday when Larry Gerald's on the panel, but I think it's an important enough question that if anyone on the panelists have a comment to make about that, I'd like you to do so. Bobby, what would you say to that?
I think I'd follow up with what Dan also posted, is that most insurance companies right now are understanding the situation and are reimbursing for telehealth visits.
Phil?
I think any situation like that, you as the provider are going to offer what services you provide. I mean, they can always find another provider if that's the way they're going to be. It's, you know, I think that's where you still have the matter of a choice on behalf of the parent. I mean, you know, insurances are coming along a lot quicker on this on the telehealth front. I mean, there were a lot of barriers in the past to this that they've closed down. I think it's going to be interesting to see how this does continue to evolve. But I don't feel as if anybody should ever feel pressured by a parent to do something they're not comfortable with.
Yeah, I'll second that. Dr. Miski, just if you're looking at the text, she just said the ADA does have some coding for this. she's on the inside track of that as well. I do think that what Phil said is important to realize. Larry Gerald will be emphasizing things like this, that you are in fact establishing a doctor-patient relationship, whether it's any type of teledentistry. If a kid is hit in the mouth before COVID, and they email you a picture, or they ask your opinion at the ball field, they're not a patient of record, you need to be aware that you have now established a formal doctor-patient relationship. And what Phil said is really important is don't ever do something that you're uncomfortable with. Larry Gerald will tell you that loud and clear. He's certainly mentioned that in other seminars. If you are uncomfortable with what the parent's asking you to do, the answer is pretty straightforward. I understand what you were saying, and he's your child, therefore your wishes will be respected. But what you're asking me to do, I'm really not quite comfortable with. So let me recommend that you get some other opinions or seek care from someone else. Now, I don't want to get mired down in this. So Martha Ann, would you rave on, please?
Sure. So step 2 was revisiting my social media communications. And this is where I think pulling in your team and having sort of some fun and positive connections with your patients, and using, we use Instagram and Facebook and our website, but we've done a couple of videos that demonstrate that we're vital and healthy. And we were careful, well, we're broken, there are 18 of us in our practice, so there's 3 doctors, three secretaries, 3 OR assistants, 3 of this and 3 of that. So we're broken into teams of 6. So we were really careful in social distancing in our initial videos, but you know, giving messages about physical distancing, taking care of your teeth. And then we did collages with messages with the entire team. So it gives the appearance that we're all still together. So the collages, if you go on my Instagram, Duke Street Smiles, you'll see a collage of all 18 with music attached, saying it's the happy song. And I think we should all just copy each other. We're in different parts of the country. If someone comes up with a great idea, I'm fine if you, take any of my ideas and it helps you. That's what this is all about. Or even if you're in my neighborhood, I'm fine. Just if it makes you happy, use it.
Bobby, are you doing something similar? Because I think this is a big issue to stay in contact, and that for the entire team. I like this collage idea. Bobby, do you have something along those lines?
Sure. To underscore your point, connection and communication with your team is vital during this time, especially with no end in sight. To echo what Martha Ann said, fun things that your patients can see, that are thoughtful, that took time to put together, sends a huge message to a relationship-based practice. A couple of other suggestions. With communication with our team, we have a closed Facebook team page that we post on throughout the week. It's a great one-spot location, central location for communication. I personally try to put up 2 to 3 positive messages and personal posts to the team each week. Another thing to do is just to make sure that the doctors consider doing a video message to your patients. In addition to the wonderful fun collages and pictures that you put up, I think the patients need to hear from the doctors that 1, we are coming back, 2, we are healthy. Our team is all healthy and are ready to come back whenever we get the green light. And just make that a fun, positive, short message, but that's been very well received from our patients.
And underscoring again, safety is our main concern. You don't have to beat it to death, but I think that's what people need to understand. I think, of course, with my predilections, I like the idea of music, but instead of the happy song, mine would probably be Stairway to Heaven or Purple Haze. Phil, do you have anything? Do you have anything, Phil?
I think I'll just echo what Bobby was saying and just kind of underline that, during this time, we have to recognize that this is just as much a psychological game that as much as a PR game, and that what we have to do is recognize where people are in their heads, and that by reaching out and doing these posts and as a doctor reaching out to your patients, look, there's people out there thinking that I don't need to do that. And the question you have to ask yourself is, this is one of those situations where like, well, what's the trade-off? I mean, if, you know, when you know, we have to recognize that the economy we're coming back to is not going to be the same economy. So anything that we can do to maintain connection with our patients is going to motivate them even more so to want to come back and see us, versus looking for someone else that they might need to establish a new relationship with in a time where uncertainty is prevailing. So, you know, I think as a human, just connecting with my patients in a way like that is important. But I think if you want to put your business hat on, anything you can do to connect and stay connect in a way that's not overwhelming them, because everyone's on information overload, in a way that can reach to the psychology, is going to increase your potential patient retention. And I know like it's tough to talk about that right now, but you know, all of us are in different places right now with our businesses, and all of us are worried about different things. So I think that the most important thing is, the reason we're advocating to get out and get in touch with your patients is because it's the right thing for us to do as healthcare providers. And we need to make sure that as they know that they're going to come back into our offices, that just simply, if you do nothing but come across as being compassionate and emphasizing safety, like that's all you need to do. Don't write some, you know, don't think you have to go out there and make some big profound statement. Just say, we miss you being here, and we're doing everything we can to make this a safe environment for you. And underlying the fact that you're healthy and your team healthy is going to alleviate a lot of their fears. So I think for people that are kind of overwhelmed with what they can do, just do something that simple. And if a video is too much for you, then just make a written statement. Do something that projects that from your office.
Very well said. Martha?
One additional comment, Gerry, on that. Don't forget that if your team members have birthdays or office anniversaries during this break, don't overlook those opportunities. Flowers can still be delivered. We have 2 team members that have anniversaries, office anniversaries. And so it's not only important to stay connected to them by saying happy anniversary or happy birthday, but that's another opportunity to post on your Facebook page and your web page that you guys are still connected and having fun.
Yes.
And tomorrow's Admin Appreciation Day. Don't forget to contact your admin people.
Right. And we have in our practice lost some loved ones due to COVID-19 in our patient families, and just sadly, we've already sent out a couple of sympathy cards. So just to be ahead of that, and then on a positive note, posting some fun tips for parents how to entertain their kids at home. And then I want to move to step 3, which is really the focus of the rest of the steps, is really safeties first. But 3 principles. I recently read an article in the Harvard Business Review magazine about how to survive a crucible moment. And 3 driving principles are empathy, listening to the concerns of your staff, your patients, but having adaptive capacity. And what that means is being flexible and being willing to pivot as the rule makers are changing the rules, and staying positive, because in the future, we will be looking back and saying like, why weren't we doing this before? Just like gloves during the HIV epidemic. Many of us, I was still in dental school at that time, we weren't wearing gloves except for surgery. And now I ask myself like, wow, I would never do that without wearing gloves. So this will be one of those moments where we're gonna look back in a few years and go, yeah, we should have been doing that all along.
I think I want to underscore what Martha Ann just said. Those people, they can adapt, that maintain a positive attitude. I'm not this rose-colored glasses stuff. People who maintain a positive attitude towards adapting as all the rules keep changing, instead of throwing their wigs in the air and spitting up and getting frustrated and letting the team see that, or even worse, letting the parents see that. Those people they're just not going to survive. They're certainly not going to prevail. Now is the time to make up your mind about who you're going to be. And you need to be that person that is going to adapt and do what needs to be done, or you're not going to survive. Martha Ann?
So this is survival in the face of a virus that's in the background all the time. And we just have to remember that. So step 3 was appointment planning. And I think you ought to start thinking about, or at least I'm thinking about plan A, B, and C. I don't know which one I'm going to fire on, but the moment the plan that's kind of rising to the top for me is to still maintain the team structure, but collapses down from 3 teams to 2 teams, of where we have the 7 to 1 a.m., the 1 p.m. block, a 30-minute really super clean, everything in the office, and then start up again. Maybe it's 2 to 8 or 1:30 to 7:30, and alternate team A and team B in terms of 1 week in the morning, next week you're in the afternoon, and then alternate who works Saturdays. And the reason for that is if there's someone in one of those teams gets sick, you know, depending on what the guidelines are going to be, that team could have to step out for 7 days if they don't have any symptoms. And you still got another team that could then fall back into working full time. And I'm also following what Duke is doing. The other thing is to keep in mind in your own office to go ahead and start to measure how far apart your chairs are. So what we don't know yet is, are we going to fall under 6 feet distancing, physical distancing, or 13 feet? Because some of the research coming out, it's a 4-meter spread. That's 13 feet. So thinking about, I do have 3 open bays. I do have quiet rooms, is how I'm grouping families. Thinking about, am I going to need the temporary partitions, which restaurants are looking at? Restaurants are looking at potentially dropping from the ceiling a clear plastic shield between tables. So kind of keep your eye out. Am I pulling the trigger to buy stuff? I'll tell you later on what I'm pulling the trigger to buy. These are things to tell you what I'm common sense thinking about of coming into play with physical distancing. And then also scripting the staff on appointment scheduling process, because we're going to be changing up depending on what rules come down as to how we're going to have to run our schedules, and having them be flexible and moving as much of the paperwork as possible, which we probably were 80% electronic. There was still some paperwork happening, but updates, everything as much as we can electronic, so they're not coming in having to touch paper or be handed a piece of paper. And then the staff that's handling all these appointment rescheduling is to, they're going to have to listen, because they're going to say, how are you doing? Great to talk to you. We just want to, we're rescheduling your appointment. There will be some sad stories. So that's where you just need to remember the advice that the tribal elder always gives us, is to, we hope for the very best for you and your family. Because that is the best that we can do, but script that. So I've actually written that down at the front desk so they can see it, and they don't have to remember, like it's there written down. It's sort of like the same sheet of paper that Bobby all taught us to put on the phone, like if it's a 911, how to call 911, like I have that on all the phones if we ever had an emergency. I'm now putting some of these standard operating procedures written down so they can see them. So the first in step 4 is measures inside the office, with safety being paramount. So a common sense thing is, I know some of you already have offices where you have the window, but some don't. So buying one of those sneeze or cough barriers that are 3 feet high and roughly 3 feet wide, maybe. I measured mine. I have 3 front desk stations. That makes sense to me too. So if someone's coming up to the desk, you're avoiding a droplet spread on your front desk. People in mine are sitting down at computers, so the sneeze or the cough isn't coming right into their face. So that seems common sense to me, and that's a low budget item to think about.
You can find that on
Amazon.
Sneeze or cough barriers are on Amazon. You can see quite a few of those. You're probably seeing them at the grocery store and things like that. But I want to echo that that's important to do now, because you're going to have emergencies coming in, and you want these people to see that you're already ahead of the game on that, because they're seeing it at other facilities like the grocery store, etc.
And depending on what kind of credit card swiper you have, is a standing operating procedure for how you're going to cover that and disinfect it. Repositioning your waiting room chairs, like we may not be able to use our waiting room chairs, but if you could space them so they're 6 feet apart, still those games probably aren't going to be played on, and no magazines, no touchy things. And then a thing that I put star is, there is good science for the UV lights, the UVC lights, and potentially thinking about having those at night. Those are turned on in many operating rooms around the United States at night. and they do kill bacteria and virus and the coronavirus. So I did a lit review, and that seems to make some sense, is to potentially look at having those lights, but I would potentially wait and see what's going to come down. But that one, that's making sense to me. And then, you know, the phase, most of our governors, I think, are saying there's a phase 1, phase 2, and phase 3, ramping up slowly, opening things up. I was super disappointed to hear in the state of Georgia, they're opening up nail salons, beauty salons, but not dentistry or vets. They were moved down into one of the later phases. So our governors are going to make some, I think, unfortunate decisions, because I think we could demonstrate that we've practiced infection control policies for a long time, and for us to tweak ourselves a little bit, I think we can handle that.
Let's just sidebar on that just for a minute about opening up and about when you're actually going to see patients. Now, I will tell you that some of the feedback that I've received from various sources around the country is there is a feeling among some to wait at least 10 days to 2 weeks once the governance of each state, or the state you're in, says it's okay to start seeing dental patients. There is a feeling among some people that they're not going to do it. They do not want to be the canary that's being lowered into the mine shaft and find out that maybe what's going to happen is what happened in Singapore, which I think everybody knows about or should know about. They opened up too soon. It's just a mess what's gone on in that country from opening up too soon. So I think you really have to think about this safety first, safety always, as to when you're going to open up or whether you're going to lay back. Martha Ann?
So moving to the clinic, still part of step 4, which is the safety measures in our office, is I think this is a truly rate limiting step, is if it's going to be required for us to wear N95s or KN95, where the K stands for Korea. Getting a hold of those is a challenge. I think face shields, hair coverings, we're kind of strategizing that we may go the route of our staff having different scrub hats for different days of the week, and then we would wash them at the end of the day. Certainly if you're wearing an N95 mask or KN95, no jewelry and no makeup. That's why I wrote yikes. But we can't wear makeup now at Duke with an N95 because it'll contaminate it. Disposable gowns, and then shoe coverings, whether you want to go with the booties or dedicated work shoes. We're leaning towards having dedicated work shoes only, that these are shoes just worn in the office, but still will be disinfected. But really, we need more science and more guidance as to when we clean this stuff, when we toss it, and when we replace it. And that's still being sorted out. So I can just tell you, Duke was the university that came up with the sterilization technique for the N95 mask, which is vaporized hydrogen peroxide, which is a ginormous sterilizer that they're taking our N95 mask at the end of the day and going, so this is when I'm in the hospital, and they go and re-sterilize them in the hopper, and then whichever one I turn in is not gonna be the one I'm gonna get if I go back to the hospital for an emergency. So can we afford one of those in our offices? I'm not sure. If they're gonna make one small enough, but just be real careful that there's a lot of black market. A lot of your dental supply companies are trying to push selling different things to do different things. I would hold off on spending any money. I'll certainly share with you when I feel like it makes sense to spend money. But right now it's trying to get a hold, because I think, let's say you're allowed to reopen May 18th, but you don't have any N95 mask. What does that mean? And I do think we have to be, back to one of my principles of empathy. I think we need to listen to our staff saying they don't feel comfortable working unless we provide them with the proper coverage. And, I will share, I do have 2 patient families where both parents and the children have all had this disease, and it was not easy. I mean, they were out for, a month to recovering. So it's in the background, and we just have to be mindful of that. I don't know, do you guys want to add anything?
Yeah, gents, something?
I just think we underscore that we don't know enough science yet to make rational decisions. We just have to wait. And make no apologies for that.
The team needs to understand how important it is that they are adaptable and don't show the frustration that everybody feels during the adaptive process. I think that's really important. You know yourself, if you go to any place, it doesn't matter what the place is for an experience. It could be a music hall, it could be a restaurant, it could be your physician's office. If you pick up that those people that are there, the team, is not happy or frustrated or annoyed, you're not real crazy about coming back. And think about how important that's going to be as we crawl back into the new normal. Phil, did you have something?
I think the only thing I will add is that when have we in the course of our profession, nor within the course of our personal lives, seen so many decisions made with such weak data? I mean, the only thing we know right now is that there is a new virus that is affecting people. And at one point, they were telling us it was going to affect a lot more people, and now affect a lot more people in more severe states, but yet the numbers continue to change, and yet we're trying to project policy. You know, I'm kind of echoing what Bobby said, and that is we just don't know a lot. And I think that's what's making this so hard for us, is that we have an increasing patient burden. You know, like we have more and more patients that are in pain, that are not being monitored, and we still don't have any clear understanding, or that the science we have is constantly changing. And I think that's very tough for us. So we kind of have to operate with the best that we know. And I think what's tough for a lot of us is that we've had a certain, at least in dentistry, and I think that's a great example you shared about how in Georgia, they're opening up nail salons, but they won't let the dentists open up. I mean, how ridiculous is that? Anyway, I don't want to digress. In dentistry, we have practiced a level of sterilization, of protecting our patients, that I think we're still, I think, trying to come up with rationalization for what are we going to do next? And does that then throw into question everything we've done before? And you have a large group out there that are like, well, wait, what we've done before has worked. What's really different about this virus? And we don't have that data. So to me, there's a lot of unanswered questions. So I definitely lean more toward the camp of patience and prudence is always going to prevail. However, I am starting to really struggle with the amount of emergencies that are mounting. And I don't have an answer for that.
Well, yeah, it's the proverbial, these are questions in search of answers. But I'm going to quadruple underscore, don't get mired up and sidetracked by how annoying and how frustrating this is. Martha Ann, during our preparation the other day for this presentation, you addressed something that was, I think, an important point about people who, once the testing is available, what's your take on testing for antibodies? And what do you know from epidemiology and such at Duke?
Well, I mean, they actually gave a great talk this morning on all three. Like when realistically are we looking at a vaccine? Probably 2021. When are the viral testing that we're having right now? Like, just to back up and say, when I'm treating a child inside the hospital for emergency reasons, they're COVID testing them, and if they're negative, then I'm using the tire that I used before COVID-19 broke out. So even the anesthesiologists were all just being normal, or what normal used to be. But that test is only considered good for 7 days, because that's the window of COVID negative viral testing is only saying that your past experience, you're negative, or it's negative because they didn't get that swab far up your nasal pharynx and it's saying negative, but that's how we're practicing. But the antibody test is, at the moment, there's not a good one, and there's a ton of false positives. So, when we're going to have that as well, I mean, these scientists and all these major medical universities are working. I mean, one of the most famous ones working on antibody tests, he was interviewed, and he's averaging about 3 hours of sleep a night as he's got his lab crunching, trying to figure this out. So the look of the antibodies looking different based on, whether the virus came across through Europe to the United States, or whether it came across from China to California and to the United States. So there's a lot of variability in this antibody testing. So we're all anxious for it. It would be awesome to be able to say that I have antibodies, but also the answer to the question, let's say I'm antibody positive. We don't have any science yet to say that affords me immunity for my life. Does that mean I won't get reinfected? We don't have the answer to that question.
Yeah, now there's an important
living
question for everybody in their family. Once the antibody test is available, I think what Martha Ann's comment is, and certainly me and my wife didn't think about that at all, is, all right, if we test antibody positive, how much confidence does that give you? And Martha Ann, you're saying that needs to be questioned. Isn't that right?
Yes. Yeah. I mean, we're pushing science without measured follow-up, and, a lot of these studies, you want several studies being done around the United States and around the world that we're coming up with the same answers before you go, yeah, that looks like, wow, this is affording great immunity. You're not going to get reinfected. We don't know that. I mean, we've never made a vaccine to a coronavirus. And some people say, well, wow, we've done it with the flu, but the flu has been one that we've been making, the vaccines have been made to it, many, many times, that when a new variation comes out, they can easily adapt and make a new one. But this is not the case. And so I think we're going to be going into the world to practice, knowing that this virus is in the background, no different than hepatitis C is in the background. All the herpes viruses are in the background, influenza is in the background, but we're just ramping it up. Why are we ramping up a notch? Because this virus is a lot more lethal, and its infectivity is a lot greater than these other viruses.
Martha Ann, this is, I wanted to add one more thing to your comment, because this is kind of where you and I, when we were discussing this yesterday, where we kind of found some agreement, because I think here's how I've kind of started framing it for my office, because there's a lot of deep science that all of us are taking deep dives on that we probably haven't had to think about since either college or dental school, right? I mean, we've all been listening to webinars and listening to experts and talking to our peers about viruses and epidemiology. The new normal for us that I think we have to look at is that, I agree with you, this virus is in the background. Now, fortunately, I think we're seeing the data come back that more and more people were infected and not showing symptoms. So the original mortality of this is going down significantly. So that's good. But I think what we have to look at is that everything we're doing in our office is to decrease exposure to viral loads. And that, what I'm trying to help my team understand is that the things that we're going to do, the things that are smart and that we currently can do, are things that we probably should have been doing in the past during a high influenza season. Because with all the people that do come in and out, and with us working in people's faces, we are at most at risk for high viral loads. So we also want to undermine that getting your own immune system is huge, but I think, the UV lights, like you said, you did a lit review on that and showed that the UV lights are huge for killing off those viruses. So anything we can do in our office to decrease virus loads is going to help with everything, not just the coronavirus. So I think looking at it from the perspective of, okay, what do we know? We know that people who are exposed to high viral loads with this particular virus, if they're predisposed to get it with, if you look at the different comorbidities that are high, like for example, like I think up in the Michigan area, you had high levels of diabetes with that patient population, not to mention the above 80 over in Italy, but you're talking about compromised immune system. So I think helping your team understand that there is going to be a new normal, but that what we're trying to do is create a safe environment is key. But I think, I just wanted to, I guess, echo what you were saying, Martha Ann, but I think helping our teams understand it from the standpoint of, we're just trying to decrease how much virus is out there in the environment, and that's going to be the best we can do.
Well said. Martha Ann?
So I just say we need to just make sure we stay informed with the rule makers, and I certainly will share as I learn more from the ADA and other organizations about, what we should do and how we should pivot. But, in terms of some of the common sense things, like I'm thinking maybe I should make a table, because down on low for me is negative pressure rooms. Maybe in the middle might make sense is a HEPA filter with the UV lights inside of them. Because definitely you don't want to be changing a filter in a HEPA filter where you don't have the UV light inside that unit. But diving into the science of that, there's still some question marks on that area. But I know, for instance, at Duke's gone from, well, maybe negative pressure help, maybe positive pressure. They've gone back and forth. Like the whole pressure thing's off, because if you're ever in a negative pressure room, the minute you walk out, you're in a positive pressure room. So it makes sense, perhaps, if you were going to be in a hospital room for 3 months being treated for a stem cell transplant, that you're in a negative pressure room. But in our situation, you might be in there for 30 minutes, an hour. I don't know. The science behind that is very equivocal. So I put that on my low priority list. But I do think that, we need to be prepared to circle back to step one. If you see the phase that government is telling us that we're going to be phased in, and at the minute they see a resurgent, they're going to shut us right back down. So we need to be able to pivot right back around, and together we need to edit what worked, what didn't work for us as we went through this again. And I think in the background, I still hear the echoing of my accountants saying, you need 3 months of cash on hand. And now I'm hearing some financial planners saying you need 6 months of cash on hand. So obviously I've had a tremendous setback, but I think to all the young doctors out there, you should be principled to make that happen as quickly as possible going forward, because we could be living in a world where this could happen on maybe not every 100 years, but in your career, maybe a couple times. I mean, who knows? But I think that's a really smart lesson. And then several of you asked, what is my current standard operating procedure for emergency care? And so one is obviously determining, is this a real emergency? Most of my teledentistry consults have been around eruption problems, which they don't need to come in for. But also determining what their COVID-19 history is. And then reviewing with the parent the new protocol. What is the new protocol? That when they come to the parking lot, they call the front desk, and when we put in this email that we send them what the front desk number is, so they don't have to stress over finding it, that we will inform them when it's time to come up, and they will be bypassing the waiting room, coming straight into the operatory. All of our doors are propped open, and only one adult with the child. Everyone's wearing masks, and if possible, to brush their teeth before arriving. Obviously, if the child's in so much pain and cellulitis, that may not be possible or comfortable for the child. And then telling them that we will be wearing N95 mask, a face shield, and gowns. And then obviously the prize box, which is so important for the child, that we'll be showing them options and then won't let them touch, we'll be handing them one. So that's sort of the current, so for me handling emergencies, and love feedback if you've added more or less, or obviously going forward, if we, with the new guidelines from the ADA saying use your clinical judgment I think if I am going to be using aerosols, then I think the scrub, I think we'll probably be moving next week to wearing scrub hats all the time and dedicated work shoes. And then I love this quote from Christopher Reeve. He said, a leader is someone who, in spite of weakness, doubt, or not knowing the answers, go ahead and overcomes anything. And I think just going ahead and trying to be future focused and trying to solve these puzzles and looking for what makes sense, I think gives you a sense of control and very settling. And then I just say, we can all be bold. We can do this. Well, go back that one up.
Martha Ann, it was absolutely wonderful. And to the rest of the panelists, I certainly would like to thank you for your generosity. I also want to thank Griff Kirstein from 3 Blue Trees. He's donated his time generously for our efforts. We hope that you found your time with us as time worthwhile. And we'll see you next Tuesday. Everything is right.